As cases of COVID-19 continue to rise in our state, medical professionals and first responders are fighting a battle that increasingly seems impossible for them not to fall victim to. But just how many medical workers have tested positive for the virus in our state? The answer is no one knows. I-Team investigator Katie Legrone explains why.
The war continues for medical workers across the country.
We do have a few healthcare providers who do have COVID-19.
And it's far past hitting home.
These deaths, they're starting to be personal. I know we lost an ER nurse.
Do you guys feel like your lives are at stake here?
Absolutely.
In Florida, Martin Peebles, a registered Florida nurse and union representative for nurses, is speaking out about the desperate conditions and fear of exposure he and nurses like him are facing, with no end in sight.
There's a lot of pressure on them to return to work, even though they fear that they may have it and that they've been exposed.
But as the risk to first responders is acknowledged at the state's highest level,
healthcare workers are obviously at an elevated risk.
Just how many medical workers in our state have tested positive for COVID-19 remains anyone's guess.
I don't know how many of them have tested positive. I don't think it's been a lot that have come through our system.
But it really is astonishing that we haven't asked this question a long time ago.
The lack of tracking of cases involving first responders on the front lines, Peebles feels, is another failure in state efforts to stop its spread.
It'd be pretty obvious. How are you going to manage something if you're not tracking it?
The overall number of positive COVID-19 cases in our state has now surpassed 8,000, more than tripling in just 1 week.
You just cannot avoid it as a physician.
Which is why Dr. Stephen Rosenberg, a South Florida dermatologist and former member of the state's Board of Medicine, believes it's too late to start tracking cases involving medical workers now.
Initially, that would have been very helpful, but right now, with the number of cases, it probably won't make a difference. At some point, every physician is going to be exposed to somebody who is COVID positive.
I'm I-Team investigator Katie Legrone, taking action for you.